ओम धम धन्वंतरे नमः। अगाधिरोगान् सततानुशक्तान् शेषकायान् प्रकृतावशेषान् औत्सुक्यमोहान् कृतान् जगान योपूर्ववैद्याः नमोस्तस्मै। So today's topic is Ayurveda management of cirrhosis of the liver. Cirrhosis of the liver is characterized by the abnormal nodule form, multiple nodules in the liver with extensive fibrosis. Also, there will be derangement in the functions of the liver. So, ascites is one of the common symptoms of cirrhosis of the liver. So, actually, in the normal liver histology, if you study microscopic anatomy, then there will be liver is made up of lobules, hepatic lobules. The hepatic lobules, there will be central vein, center, and the periphery. There will be concentric hepatic lamina surrounding the central vein. And at the periphery, there is a portal tract. Portal tract made up of tributary of the portal vein and hepatic artery and bile duct. So between the hepatic lamina, there are liver sinusoids and also the tributaries of bile canaliculi. The liver is responsible for digestion and metabolism, mainly carbohydrate metabolism, fat metabolism, protein metabolism, synthesis of glycogen and storage, the storage of vitamins, detoxification of drugs, and destruction of RBCs, that is, destruction of RBCs and synthesis of RBCs, means hematopoiesis, and also other the secretion of bile. These are the few functions of liver. So in the cirrhosis of the liver, if you see the microscopic anatomy or histopathology slide, there will be formation of multiple nodules and there will be extensive fibrosis. And in the nodules may be micro nodules or macro nodules. The cirrhosis may be micronodular cirrhosis or macronodular cirrhosis or mixed type of cirrhosis. So histopathologically, micronodular cirrhosis means there will be multiple nodules which are having diameter less than 3 mm or equal to 3 mm. In the macronodular cirrhosis, the nodules the size is bigger than 3 mm. The mixed type of cirrhosis, there will be both micronodules as well as macronodules. In Lanic cirrhosis or nutritional cirrhosis, or it is also known as alcoholic cirrhosis, there will be mixed type of cirrhosis. Cirrhosis can also be classified as follows. Number 1, biliary cirrhosis. Number 2, Indian childhood cirrhosis. Number 3, post-necrosis cirrhosis. Number 4, cirrhosis due to hemochromatosis or iron overload. Number 5, cirrhosis due to copper metabolism or Wilson's disease. Number 6, cardiac cirrhosis. Number 7 is idiopathic cirrhosis. We don't know, or it is caused due to doctors. for this one. And number 8 is the cryptogenesis. We don't know what is the actual cause of cirrhosis. These are the common, and also syphilis also has this. These are the common types of cirrhosis. Indian childhood cirrhosis, as in seen in Rajasthan villages, there is the infants or the children are fed with milk and other food articles which is stored in the bronze vessels. It is contaminated with copper, and chronic copper ingestion causes damage of the liver cells and causes cirrhosis. So ascites is common symptom of cirrhosis. So there is retention of abdomen because of accumulation of fluid in the peritoneal cavity. So cirrhosis of the liver will having these clinical features. They are ascites and caput medusae, portal hypertension symptoms, hemorrhoids, esophageal varices, and rupture of the esophageal varices causes cough ground vomiting or hematemesis or melena, which is black and tarry stools. So there will be liver palm or liver palm. There will be telangiectasia in the skin, ecchymosis, petechiae will be seen. Then sometimes the volume over bilateral pedal edema, that volume overload will cause attention of sodium in water, cause volume overload, and there will be left ventricular failure and features of pulmonary edema, that is paroxysmal nocturnal dyspnea, orthopnea, cough with expectoration, dyspnea, and other symptoms. And there may be hepatic encephalopathy, there may be altered consciousness, stupor, delirium, recoma, coma, and death also can occur. Hepatic tremors, gynecomastia, amenorrhea or oligomenorrhea, impotency, sterility. These are a few of the clinical features, signs of cirrhosis of the liver. So this is the caput medulla. You can see engorgement of veins along the liver palm. The color of the palm is reddish purple. Okay. Seen in of the liver. Gynecomastia. Gynecomastia also seen in case of cirrhosis of the. This is the Patukarohini, that is Picorazakarova, that is the protective drug. It is hepatic stimulant, coagulagol, rasayan also. It's bitter in taste and used in liver disorders. The diagnosis of cirrhosis of the liver is made by liver function tests. Liver function tests, ALT, AST, alkaline phosphatase, serum total protein, serum globulin percentage, serum albumin percentage, albumin globulin ratio. These are all most common and investigations. They are done in cirrhosis of the liver. Ultrasound is confirmatory to have the cirrhosis of the liver diagnosis. There will be echogenicity will be seen. On palpation, liver will be hard with shrunken liver will be there. There sometimes it may be palpable and hard liver, not large liver. So treatment of cirrhosis of the liver includes the treatment of underlying pathologies and also comorbid situations. So we give hepatoprotective drugs, Virechana drugs, hepatic stimulants, coagulagol drugs, and rasayana drugs, and hematinics, diuretics, protein supplementation, and if there is respiratory symptoms, we give expectorants, mucolytics, bronchodilators, antimicrobials pertaining to the respiratory tract. If there is hematemesis, if you use Andhra Shirasava, Kamadugarasa, Pravada Panchamadharasa, if not controlled, you have to go for surgery. That is, banding is done. There is veins. If there is melina, also similar medicines are given. If there is diarrhea, antidiarrheal drugs are given. When there is protein, serum total protein is less than 6 gram percentage, and albumin ratio is reversed. This is due to decreased release of proteins in the liver. We have to give protein supplements. That is dal or mamsarasa can be given. And if there is ascites and bilateral pedal and sarka, diuretics like Varnashikur Kashaya, Ranapanchamala Kashaya, Ranava Mandora, Vetabarpati, and Pashana Vedati, Kashaya, Gokshara Vijayasuna. So if not controlled, we give the modern drugs like furosemide, Lasix, or Lasilectone, combination of furosemide and spironolactone. Spironolactone is a potassium sparing diuretic. So by giving only furosemide, there will be depletion of the potassium in the blood. If you add Lasilectone, spironolactone, there won't be side effects like hypokalemia. So bronchodilators like Soma Churna, Somasava, Kanakasava, Pushkaramulasa can be given. Expectorants like Vasakarishta, Vasavaleha, and Pushkaramulasa. Bronchodilator, expectorant and mucolytic like Vasavaleha and Talisal Churna, Utaparal Churna. This is the Kumari, aloe vera. Kumari also is available. It is given in liver disorders. Brangaraja Sava is available. So we can give Brangaraja Sarasa also we can give in patients of liver cirrhosis. This is the Guduchi, the Pinospora cordifolia. A lot of research has been conducted on Guduchi. That is Pinospora cordifolia. It is hypoglycemic, hepatoprotective, and rasayana drug, immunomodulator, and other qualities. Best Guduchi Kata we can give in cirrhosis of the liver. This is the Bhumya Malaki, Phyllanthus neroli. It is the beneficial in hepatitis B. Research has been conducted in BHU, Banaras University, regarding the efficacy in serum hepatitis or hepatitis B. It is found effective in hepatitis B. Professor Dr. Ramji Anojia from Banaras University has worked on the hepatoprotective activity and its efficacy in hepatitis B. And Amalaki is Phyllanthus Embolica officinalis. That is very useful Rasayan and Vayastapana drug, and it is given in liver disorders. Can use Datri Loha, or we can Amalaki Swarasa or Amalaki Rasayan. So coming to the Patyas, Patyas are high protein diet, salt and water restriction. Rasayana food which is having Madhurasa, nutritive food, Poshakahara, and walking, which can be given. These are wholesome to patients of cirrhosis of the liver. Tender coconut water, barley water. So these are all useful. Apatyas are fatty food, fat-containing food, curried and fried items, Pittavardhaka Ahara Vihara, and food containing high fat. These are all apatyas in case of this liver. Not all salt, excessive salt and water also. They are apatyas in liver. So, treatment of cirrhosis of the liver is integrative approach. Integrative medicine is very useful in case of cirrhosis of the liver. And modern diagnostics we can confirm the disease and its comorbid situations, complications and comorbid situations, the extent of damage of the cell tissue, and we can plan the treatment in terms of modern principles as well as Ayurveda principles. An integrative approach will be more effective in this. The patients which are having short history of cells of the liver, they are best responding to the treatment of Ayurveda treatment. However, advanced cases where complications are there, it is incurable or difficult to cure. Most of the times, it will lead to the hepatocellular carcinoma or the malignancy and death. Thank you for patience.